Can you hear me? But I cannot hear anybody. Can you hear me?
Yes, yes.
I cannot hear anybody.
Yes, yes. Yes, yes.
Am I audible?
Yes.
Okay. Can I share my screen?
Good, doctor. Good.
هيك بس تسمع البتاع اللي اسمه تك خرا ده يا عم.
You see my screen? Can you see my screen?
Yes, doctor.
Am I audible now?
Yes.
خرده يا عمر.
So tell me when to start.
Let's start now, if you want.
You see my screen? Can you see my screen?
Yes.
Am I audible now?
Yes.
Yes, sure. Go on. Go on.
So tell me when do I start? Is somebody to introduce me? When to start?
Start now, if you want.
See my screen? Can you see my screen?
Yes.
You can start now, doctor. The screen is clear.
Okay. Assalamu alaikum, all my dear friends from the Arab world. I especially thank Dr. Shedi Salam, who is the president of Middle East Association of Aesthetic Medicine and also Arab Society of Fetal Medicine and Surgery. And I'm very, very much honored to be amidst you, ladies and gentlemen, my sweet angels from Arab world, to have given me the opportunity to share my views, thoughts, concepts, and passion. And today I'm going to speak on something which I'm very, very passionate about. And that's been the mission of my life, because we all have been under taboo. And now I don't want my children to be under taboo. So I'm increasing the awareness through the means of educating my own medical brethren. You all medical messiahs from Arab world, you also take up this task and see that this particular topic of sex is no longer a taboo for our children, because we all have suffered through this, and we all know that we are all born out of sex, but still we don't talk about it, because sex is a very long subject where culture and natures collide, and to navigate through the mysteries of sex is a defining question. The sexual health is the prime concern of every human being today, because that is linked to the heart, so it's a vital part of our personal wellness. If our sexual health is normal, sexual fitness is normal, we can live longer and the longevity is procured. And today we are living in a very difficult times, very uncertain times. These uncertainties in the climate, the uncertainties in the viruses, but we need to adapt to the new situation and see that we are safe and we are sexually healthy, so that we can be cardiovascularly healthy also. uh, we need to come out of the belief systems where our parents told us that sex is bad, sex is sin, sex is dirty. No, it's not. It's a normal and natural function of our life, and we need to talk about it, and we need to be open to our children. We need to tell them what the queries are in a very simple and non-judgmental way. So my talk today is on sexual health, which is the need of today. I'll be telling you why it's the need, and I will be also describing one of the male sexual dysfunction, which is erectile dysfunction, as to how it can create havoc in a man's life and how it can be totally, completely managed today without any problems. So, in this next 30 to 40 minutes, I will take you through a glimpse of how sexual functions can be managed today, and this is the need of the hour today. With pranams to God and thanks to my teachers, there is some disturbance in some voice, some. I thank my teachers, Dr. O.P. Kapoor, Dr. Prakash Kothari, and Sashank Joshi, and I beseech them to bless me always. I have no conflict of interest. There have been only two taboos in the world: sex and death, and they are deeply connected. Sex represents life because all life arises out of sex, and death represents the end. Is sex a secret? Who doesn't know what is sex? Everybody on this earth knows what is secret. But is what is important for us to understand, that sex is not a secret, but it is a sacred thing to be done. So that is what is to be learned. Sex is the sacred song of the soul. is the sanctuary of the self. Sex is like a physics, and love is a matter of chemistry. And when it is intimacy, it is both chemistry and physics. And intimacy today we know can lead to longevity, because there's a lot of evidence to prove that people who have regular sex have a longer life, less heart attacks, etc. Intimacy, though it's ageless, but we need to ignite strategies for mind and body for getting optimum sexual pleasures. According to the WHO, the definition of sexual health is it's a state of physical, emotional, mental, and social well being in relation to sexuality. It is not just merely the absence of disease, dysfunctions, or infirmity. It requires a positive, respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences. It should be free of coercion, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of every individual must be respected, protected, and fulfilled. What are the elements of sex life? If you look at the holistic and positive approach, sexual health is nothing but sexual well-being or an individual's life-being. It's not just merely absence of disease. It involves respect for your partner. It involves safety and freedom from discrimination and violence. Sexual health depends upon the fulfillment of certain human rights, is relevant throughout the individual life. It is not just only when you get married or when she is young. No, it only to those reproductive years, but also to both young and to the elderly. And it is expressed to diverse sexualities and forms of sexual, be it a gay, be it a lesbian, be it a transgender. It is to be respected. Sexual health is critically influenced by gender norms, roles, expectation, and it needs to be understood. And today we can correct all the sexual dysfunctions which a man or a woman have very comprehensively and give them a good quality of life. So, according to the Diagnostic Statistic Manual 5, the sexual dysfunctions are diagnosed by these four problems in male and female. In males, it is low sexual desire disorder, erectile dysfunction, ejaculatory disorders, and substance of medication induced sexual dysfunction. And in female, it is again sexual interest or arousal disorders, orgasmic disorders, or genitopelvic pain penetration disorders, and of course, substance and medication induced sexual dysfunction, which is there for both. When you look at a male or a female sexual response cycle, it begins with the desire, leads to arousal, and then there is the ejaculation and resolution in males. In female, it is desire, again lubrication, and orgasm, which can be one or many or no, and then there is a resolution. So the cardinal events which occur are desire, erection, penetration, and orgasm. And all the dysfunctions are focused on these four cardinal events. Sometimes it can be low desire or high desire, erectile dysfunction, penetrative disorders, or orgasms. Same with women. We have either less or more, less lubrication, less orgasm, penetrative pain disorders, etc. So we need to ask every patient these four cardinal questions and come to a diagnosis. I have some breaking news to give you. We have 40 to 50% of men across the globe who are not satisfied with their sex life. And in a beautiful survey done, 62% of women admitted that they were not satisfied with their sex lives. And a shocking news that 50% of married couples in the most developed country like Japan are living sexless life. And we have seen that sexual dysfunctions affect the partnership and the relationship. And 1 out of 5 failed marriages are all due to sexual dysfunctions in men. And beautiful thing which I just read, Dr. Naima Al Gasser, who's my friend from WHO, who's a representative in Egypt, they've started they've launched a mental health platform, and soon I'm sure that they will start a sexual health platform where individuals can come and discuss and sort out their issues. Very good. Congratulations to Egypt for starting these things. Now let me give you a little deeper or different perspective. In India, sexual health emerges as a new parameter for strong relationship. This was a beautiful survey done. The today's youth is being empowered. They are not dependent on the husband for the financial security. They want something more. They are coming out. They are more compatible. They are more expressive about their discussing about their sexual issues. And what I found was erectile dysfunction affects 50% of the male population who are above 40. And when I googled, I found Viagra had 196 million web pages and aspirin had only 53 million web pages. And friends, please trust me, sex really has no age. From 9 years to 90 years, a man or a woman can have sex. And it can be any time, morning, afternoon, or night, or whatever time. And at the end of my talk, I'll make you believe that sex really has no expiry date. It's not how good you are in sex, but how good you want to be. That's the question. And according to Alfred Kinsey and American Heart Association and American Urological Associations, they all agreed that sex is the best prescription for good health and longevity as it improves every system of our body, be it cardiovascular, respiratory, immune, bladder control. It reduces stress and make you live longer. And it is also said that use it or lose it. And it is today, it has become the erectile dysfunction. If you talk about men, it's become the proxy of general health according to the International Classification of Disease 9th revision. So this has been proven. And did you know that men have higher death rate? Men live 5 years younger than women. So this is the sad thing, that men are living shorter than men, shorter than women. And this overlooked inequality between men and women have revealed two to three things which are very important. All men today go to the gym. They have a forged physique. It's not the normal physique what they have. They have heterosexual prowess. They are only dominating. They have career dominance, and they want to feel new. And the focus is on the man's main hormone, the big T, the testosterone, as the key to your performance, be it in the gymnasium, be it in the bedroom, be it at the workplace. And what is more surprising is that the association of testosterone with masculinities is further emphasized by statements claiming that women prefer testosterone fueled men because they are more assertive, and women also admire testosterone honed muscles. So we need to lead the future by changing the attention of men's health, because though there is less life expectancy in men according to women, this health gap need to be addressed, and we need to pay attention to the, besides the maternal and child health, also to men's health. And the dark side of testosterone deficiency is that there is a close relationship between hypogonadism, which is nothing but testosterone deficiency, and metabolic syndrome, which is diabetes, blood pressure, high blood pressure, cholesterol, obesity, etc. So metabolic syndrome is closely associated, and it is one of the reasons with increased incidence of cardiovascular disease. And the focus has to be on relationship between testosterone levels and three diseases, which include sexual dysfunctions, metabolic disease, and cardiovascular disease in turn. So we need to also understand that when the testosterone level decreases, there is increased mortality in men with coronary artery disease. So there is definitely link between sexual functions or dysfunctions and the cardiovascular disease, which we'll come to later on in our this thing. So metabolic syndrome, testosterone deficiency, and erectile dysfunctions never come alone. They all come together. And today, when we see the status of cardiovascular disease, is the leading cause of mortality across the globe. So men die of, or women also die of cardiovascular disease, and this is the leading cause of death across the globe, more in India. And there is definitely a relationship between erectile dysfunction and cardiovascular dysfunction or disease. So erectile dysfunction is nothing but subclinical cardiovascular disease, and we need to, this can be a marker, this can be definitely an indicator of a person who could get myocardial infarction or stroke in his later life. And sexual functions will mirror the overall men's health status, as has been proven by a lot of scientists. So we may trust that erectile dysfunction is a sentinel marker for undetected risky diseases, which are not only cardiovascular disease but other diseases also. So for men's health initiative, erectile dysfunction has become a focal point of attention. So the lessons learned in our life are: one of the determinants of men's health is testosterone. Low testosterone plays a key role in metabolic syndrome, sexual dysfunction, low desire, and of course cardiovascular disease. In this urbanized and industrial conditions, is situations which we are in today, we are seeing four type of patients. We are seeing diabetics, we are seeing hypertensive, we are seeing obese and dyslipidemic patients. And diabetes, friends, please understand, it is the sexual health tsunami of our century. One out of every third Mumbaikar is a diabetic, and it's the incidence of diabetes is so alarming. Now, let me tell you one disease or one symptom of erectile dysfunction as to how this can play havoc in a man's life. And there are similarly many other conditions in men as well as in female. I will not allude it to all of those diseases, but I'll just focus on one disease to give you a glimpse that how sexual health is so important for today, and it is the need of the hour today. Sorry for this claim. We all know erectile dysfunction is nothing else but inability to attain or sustain erections for a good sexual intercourse. This situation or this symptom has to be there for at least 6 months according to the DSM criteria, and there has to be definitely an interpersonal distress amongst the partner. Why is this not moving?
شكرا شكرا جات يا روح شكرا
البينات فقالوا أبشر يهدوننا فكفروا وتولوا واستغنى الله والله غني حميد زعم الذين كفروا أن لن
Hello, just wait, I have restarted the presentation.
ثم لتنبؤن بما عملتم وذلك على الله يسير فآمنوا بالله ورسوله والنور الذي أنزلنا والله بما تعملون خبير يوم يجمعكم ليوم الجمع ذلك يوم التغابن ومن يؤمن بالله ويعمل صالحا يكفر عنه سيئاته ويدخله جنات تجري من تحتها الأنهار خالدين فيها أبدا ذلك الفوز.
When you look at the historical aspects of erectile dysfunction, in 2000 BC, Egyptian papyrus outlined two types of erectile dysfunction. Look at the history. They thought it could be natural, the man is incapable of accompanying the sex act, or it could be supernatural, the evil charms and the spells. Then it was Hippocrates in 460 to 370 BC. He says that it could be due to excessive horse riding. And Aristotle said that there are three branches of nerve which carry spirit. Erection was nothing but influx. It was Leonardo da Vinci in 1452 who found that the, 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 the criminals who were hanged, and from their testicle there was blood coming out. So he debunked the Aristotle's theory that was held for over 1000 years, and this was kept secret for 20 centuries. embryos pair.
بس محمد عامر بيشتغل
There is some music going on. Please stop that.
غير اشرف وانا فوجئت في واحد اسمه محمد وفي واحد اسمه إيه؟ محمد هو ابن عبد الرحمن عامر. قال له روحي له خليه يديك
Can you stop this music, please? Or can you mute the person who's playing this? It was embryo spread who gave us the proper information about what actually happens in a man when he gets erections. And even in Indian books like Susruta, it is mentioned that impotency has so many causes. Even in Japan today, they still celebrate and in respect to the awareness on HIV and LBTQ. In temples of India, we still find gods' images with erect penis. So this was yesterday. So what is today and what will be tomorrow? Let me give you a modern perspective of it. So what is a understanding, the scientific understanding of erectile dysfunction, that it is nothing but the endothelium which produces endothelial nitric oxide synthetase, and this enters into the corpora cavernosa uh, or smooth muscle cell by sending nitric oxide into the cell, which converts guanosine triphosphate into cyclic guanosine monophosphate with the help of an enzyme called guanylyl cyclase. This cyclic GMP through protein kinase G mechanism relaxes the smooth muscle and allows the blood to flow inside the penis. But sadly, this cyclic GMP hydrolyzes into 5-GMP with the help of an enzyme called phosphodiesterase 5. So, if you have to look at the therapeutic point of view, or if you have to look at the man getting good erection, what does he need? First, he needs endothelial nitric oxide synthetase. Now, this can only be got if the endothelium is normal. Hence, a patient or a man who has erectile dysfunction is nothing but endothelial dysfunction. So what he needs is adequate amount of endothelial nitric oxide synthetase. He needs this nitric oxide, which is the main chemical signaling molecule to initiate the whole erectogenic mechanisms. He needs cyclic GMP to be there in more bioavailable form, and he needs something to block this phosphodiesterase 5. Today we have all the things which can block this enzyme in the form of sildenafil, tadalafil, vardenafil, udenafil, and now we have new kid in the block which is called as avanafil. So when you look at diabetes, when there is hyperglycemia, there are advanced glycated end products and oxidative stress. All these lead to reduction in endothelial nitric oxide, and nitric oxide is inhibited, and all these ultimately lead to cavernosal endothelial dysfunction, and there are not only functional but structural alteration, ultimately leading to erectile dysfunction. So one take home message is that we need to see that the endothelium of every man has to become normal if he wants to have good erections or a normal erections. So in diabetes type 2, erectile dysfunction and endothelial dysfunctions have a common link. This is the definition of erectile dysfunction. The flaccid truth is that it is endothelial dysfunction, also causes emotional dysfunction, and these are the manifestations of aging and age related complications which include diabetes. Now, we all are aging. Do we all go through this? Do we all get erectile dysfunctions? No, it is not true. So, what happens in aging? Aging is not a disease. If aging is a disease, life will also be a disease. What is the main important thing about aging is that it is nothing but pro-inflammatory all in. And we need to keep this mind in our mind that when we get aging, every tissue of our body is inflamed due to stress, oxidation, cytokines, DNA damage, stem cell aging, etc. And all these can lead to inflammatory status, which can cause a lot of other problems itself. And we all are living in a pro-inflammatory state. So this we, and diabetes also is an inflammaging disease. This was our beautiful study which we are still going on, 56,000 patients, and most of the males had erectile dysfunction, early ejaculation and low desire, and females had low desire, but depression was the common thing which we saw in every woman, and they don't need antidepressants, they need something more than that. So what are the causes of erectile dysfunction? We have psychogenic causes, vasculogenic causes, neurogenic causes, hormonogenic causes, drug induced, and today to add salt to our wounds, it is even genetic. We have found that in more than 40,000 men, which were studied in multi-ethnic Kaiser Permanente in North California Genetic Epidemiology Research, and they found that they identified a single locus, which is the number RS171855360 on chromosome 6 near a single-minded family. So this was associated with erectile dysfunctions. COVID-19 again is an endothelial disease. We have found COVID viruses in the cavernosa muscle cells, but it is not a sexually transmitted disease. But what is more important for us to understand, that there is a bidirectional relationship between COVID-19 and diabetes, because SARS-CoV receptor ACE enzyme type 2 is expressed in human pancreatic islet beta cells and is upregulated by inflammatory cells. So a person having COVID can get diabetes, or diabetic patients can also get COVID very easily. And we know that India and China are having the maximum patients with diabetes. So I call Chindia are the diabetes capital of the world, and erectile dysfunction is the commonest complication of diabetes in men. So Chindia are the erectile dysfunction capital of the world. And when you look at obesity, the visceral obesity will produce endothelial dysfunction, also produce testosterone deficiency. It's an inflammatory response. There is a microvascular disease and leading to erectile dysfunctions. And most of the metabolic syndrome have impaired endothelial functions, be it hypertension, be it dyslipidemia. And metabolic syndrome in men have organic disease, which is nothing but erectile dysfunctions. Erectile dysfunction is nothing but reduced blood flow inside the penile vasculature. So I call ED is nothing but penile angina or penile attack. So why should we be worried about erectile dysfunction? Why should we be worried about sexual dysfunction? It's people are living normally and nothing is seen. There is nothing like cancer or fever or cough or anything happening. So why should we be worried about? Is erectile dysfunction a signal for impending disease or disaster? Yes, it is. 1,36,306 patients who were studied, they found that they did not disclose about the symptom of erectile dysfunction to the patients, and they came very, very late in their life with the complaints of ED. And these patients were not improved with drugs, they needed surgical treatment. So that is one risk. And more than 1 lakh patients in Taiwan who were studied with having erectile dysfunction, these patients developed dementia. So we don't want our patients to become dementic. So we need to understand ED can lead to dementia. And what is more important is there are a lot of patients in India who have been committing suicide. And these patients are all on anti-diabetic drug which we give to them. It is not the anti-diabetic drug or the hyperglycemia or the dietitian saying that don't eat this, don't eat, control your diet, don't eat sugar, etc. It is the sexual dysfunctions with which they are emotionally disturbed and they can get suicidal thoughts and behaviors. This is what is very important. But so what do we do for ED? Do we have a vaccine? Is pancreatic transplant an ideal? Is gene therapy going to be? So it is definitely, these are the patients whom we need to reach out. Why we need to reach out is because today it is clearly studied that erectile dysfunction is the earliest marker of myocardial ischemia. And Montessori beautifully explained to us with the artery size hypothesis. The penile artery is the smallest, 1 to 2 millimeter. Coronary artery is 3 to 4 millimeter. Internal carotid artery is 5 to 6 millimeter. And femoral artery is the largest. And when atherosclerosis develops, it develops gradually, it develops uniformly in all the vessels. So if 50% of the penile artery gets blocked, these patients will get erectile dysfunction. But the same amount of atherosclerosis do not occlude 50% of the coronary artery, do not occlude 50% of the internal carotid or femoral artery, because the diameter is more. Hence, the patient who has erectile dysfunction will not at the same time have angina or myocardial infarction or stroke. But we know that atherosclerosis is progressive. Sooner or later, this patient whose 50% of the coronary artery did not get blocked and did not have symptoms, but in future he will definitely get disease. And the duration between this onset of penile artery blockage and coronary artery blockage is about 3 to 5 years. A beautiful study said that the ED symptom preceded coronary artery disease by a mean of 2.5 to 3 years in most of these patients. So what do? We ask our patients, after he gets angina or after he gets an attack or stroke. No, we need to ask our patients much before then he gets heart attack or he gets an angina. It is at the age of 30 in patients who got a family history of metabolic syndrome to ask our patients that do you have problems of erections or do you have problems in making love. And if he says yes, you can counsel him, you can change his lifestyle, reduce his sugars, oil, and pressure, and retard the onset of critical events in his life. The clinical acumen of a physician, of a smart physician, lies in asking his patients as early as 30 years in the patients who have a family history of metabolic syndrome. I call penile attack almost equals heart attack. Because when you look at the disease progression of cardiovascular disease, which starts from endothelial dysfunction to clinical events, and throughout these symptoms of risk factors to the clinical disease, these patients had erectile dysfunction. So we have enough evidence to prove that if a patient has ED, he's surely going to get cardiovascular disease. And in fact, ED can be the prognostic value of cardiovascular disease. So there is a wealth of compelling evidence to prove that ED is a risk factor of coronary artery disease. And we know that patients, the global cause of mortality is nothing but cardiovascular disease. So it is up to us. By a simple symptom, we can reduce the onset of cardiovascular disease across the globe. And the real world studies have said that erectile dysfunction, diabetes, cardiovascular disease, and depression all need to be treated holistically together. It is not just treating diabetes, it is not just treating cardiovascular disease, all have. So how do we manage erectile dysfunction? Now, the first thing you must understand that if a patient of erectile dysfunction, you need to call the husband and the wife together. The couple has to come together. The problem may be in the male or in the female, but the treatment or the solution always lies in the couple. There may be a menopause or andropause, but sexual dysfunction definitely causes couple pause. Hence, couples should be counseled together. There are two beautiful validated questionnaires, IIEF and SHIM, which are available. Rule out the psychogenic causes of erectile dysfunction by asking one simple question, that in last 8 to 10 days, did that patient who came to you for erectile dysfunction had morning erections? If he had morning erections, he has got psychogenic or situational erectile dysfunction. He does not have organic disease. He does not have organic erectile dysfunction. He does not need PD5 inhibitors. All he needs counseling. And we manage it by giving advice on smoking, diet, exercise, blood pressure to be brought under control, lipids, HbA1c to be less than 7. You examine his eye, feet, put them on guardian drugs. But one thing is very important. Every time when a patient comes to you, please look at the retina, please look at the feet and the oral hygiene. This has to be checked. Don't go by the American or European recommendation that eye, feet, and oral hygiene is to be examined every 3 months or 6 months. No, but every time when the patient comes to you, look at his feet, look at his retina, and look at his oral. And you can also give office sildenafil 550 mg or intracavernous papaverine to rule out psychogenic from this thing. Other tests which we do are serum testosterone, free total, sex hormone binding globulin, thyroids, FSH, LH, vitamin D. Now, hypovitaminosis D has been the common cause of erectile dysfunction. We do sonography of the scrotum, Doppler studies, PSA free and total, because if you want to give testosterone, you need to monitor PSA very well. Digital rectal examination and Regiscan has to be. This is a very novel instrument where two electrodes, one is at the tip of the penis, one at the base of the penis, and this is tied to this gadget, and the whole software in the computer manages everything. Patient is made to sleep overnight and in deep REM sleep. If he is normal, if he's got no organic cause of erectile dysfunction, you will see 3 to 4 to 5 erections which last for 15 to 20 minutes, and this is absolutely normal finding in a normal patient. But if he has got organic ED, you will not find erections, and this is how you can rule out psychogenic to erectile dysfunction. But I don't send my patient for this sophisticated test because very costly. Patient have to sleep in the hospital for 2 to 3 nights. I give them a roller of stamps which I get free from the post office. I tell them to tie it snugly on the shaft of the penis and sleep. If the stamp breaks in the morning, he is normal. He's got psychogenic erectile dysfunction. Salivary tumor necrosis factor alpha, very simple. Just put a swab on the gums and do the testing. You'll find this patient's having erectile dysfunction just by looking at the patient, not even asking the patient, spot diagnosis you have. And a very beautiful study where platelets and lymphocyte ratios have been studied. If the platelet and lymphocyte ratio, which we do it in normal CBC, if it is 104, he does not have erectile dysfunction. But if that ratio is more than 104, if it is 105, he's got mild ED. If it is got 116, he's got moderate. And if it is 136, he's got severe erectile dysfunction. So just look at the CBC report and do a mental calculation. If you are embarrassed to talk to him, but if you find that the ratio is more than 105, 106 or 130, you can then confront with your patient and you know that he's got erectile dysfunction. So you can counsel him at that time. We have serum endothelial cell specific molecule called endoscan, which is very simple test. You can do it. It's a simple blood test, not expensive, and you can diagnose endothelial dysfunction or erectile. How do we treat erectile dysfunctions? First line of treatment is oral drugs, counseling and lifestyle measures to be advised. If these oral drugs do not help him, give them injections of papaverine and largactil in the intracavernous tissue, vacuum therapy and intraurethral prostaglandins. And if all these fail, we send our patients to the surgeons who do penile implants or they do anastomosis. But counseling and lifestyle measures, friends, please don't forget, this is the mainstay of treatment for every sexual dysfunction. Even if they go to the chemist and buy Viagra, they don't respond very well. They don't get erections. But if you counsel them and give them all the lifestyle measures, advices, he will definitely improve. Because even the research says in 2018 revision of care that lifestyle changes may be accompanied by the first line treatment. We had most of the PD5 PD enzymes are scattered all over the body, and that's why you see a lot of side effects with this. We have 17 years experience with PD5 inhibitors, but they are not one and all drug for every patient. We have found they are effective, they are definitely good, but they do not cure erectile dysfunctions. So we have 4 PD5 inhibitors, sildenafil, vardenafil, amongst them tadalafil has got, but they have got a lot of side effects like flushing, headache, nasal congestion, dizziness. Contraindications are nitrates. We should not give to these patients who are on nitrates or who had recent cardiovascular events or who have got potential hypotensions or any anemias or lipomas. And we have found 50 to 60% patients not responding to PD5 inhibitors. Internationally, it has been studied. And the reasons are they find that they need the drug to get erection, so it hurts them. So they discontinue and they feel that it's not working. They have ego issues and all that. So what is the new strategy? New strategy is to give them low dose PD5 inhibitors for a longer time, because they do help in increasing the CGMP, dilate the blood vessels, increase the PKG activity, increase the thromboresistance, reduce the smooth muscle contraction, and reduce inflammation also. And beautiful studies done in diabetes proven that 12 weeks of low dose of tadalafil, irrespective of whatever be the HbA1c or hypertension or prostatic hypertrophy, even dyslipidemia, this will definitely improve their sexual functions. Why they don't respond is because you don't give them in proper dose. You don't tell them when to take it and how much, and they should stimulate themselves. Or these patients come very late to us. They've already taken a lot of drugs before. So these are the reasons why PD5 inhibitors fail. My friend Dr. Jyoti Dev tried insulin pump to these patients and showed 83% improvement in their sexual functions. And we have now known that metformin improves the endothelium and it can be given to patients who got erectile dysfunctions. Another beautiful drugs is SGLT2 inhibitors, be it dapagliflozin, empagliflozin. They, because of the class properties of the drug itself, reduce weight, reduce hyperglycemia, reduce dyslipidemia, and antioxidant effect. And all these combined with metformin, they reduce all the vasculogenic causes of erectile dysfunction. And these patients start getting normal erections. They don't need PD5 inhibitors. So that is the advantage of giving diabetics PD5 inhibitors. Instead of PD5 inhibitors, you give them metformin and SGLT2 inhibitor. It works fantastic. Buried penis syndrome, very common. We find these obese patients can't even look at their penis, so it's very difficult for them. For them, a beautiful study which we did and was published: sesame seed oil to be massaged, L-arginine gel and metformin 1 gram for 6 weeks. They could see their penis and then give them PD5 inhibitors and see that they perform very well. There are a lot of newer novel things like low intensity extracorporeal shockwave therapy, platelet rich plasma. But what we are seeing in treating ED, none of these therapies, however, reverse the pathology of erection. The pathology we know is endothelial dysfunction. No therapy across the globe till date have reversed the endothelial dysfunctions. So we have newer things which are coming. Amongst them, platelet rich plasma, stem cell therapy, gene therapy have been proven to be very, very effective in these patients. So one point we need to think is erectile dysfunction just a symptom or a disease? If you consider it to be a symptom, you need to give them pharmacotherapy because he wants immediate cure, he wants immediate erection. But that's not, again, he doesn't have erections next day or third day. So if you consider it to be the same, it is a disease where you need to give him a cure, and the cure is possible only with regenerative medicine or phytonutraceuticals. Now, what are regenerative medicines? It is in the form of stem cells. In diabetic, 15, only 7 patients they studied, and these patients did not respond to any line of therapy in medicine. So the 15 million human umbilical blood stem cells were infused in the corpora cavernosa of these patients, and they found 6 out of 7 men started getting morning erections without taking any PD5 inhibitors. So this is the regenerate. Our body skin gets completely worn off in a month, and we see new skin coming up. We don't take any drugs for regenerative regeneration of the skin. Similarly, regenerative medicine with stem cells is going to cure our patients with erectile dysfunction, but we need robust evidence which is still lacking in our life. Another phytonutraceuticals in the form of L-arginine. L-arginine is nothing but nitric oxide donor. Nitric oxide, we know, initiates the whole erectogenic mechanism. It is a vasodilator and it is definitely needed for good enough sex. And along with that, fenugreek seeds in this saponized form, which has got a chemical composition like testosterone, increases desire. So with these two phytonutraceuticals, the fenugreek seed and the L-arginine, you have a desire and erection both. Amongst the male sexual response, the desire is taken care of and the erections are taken care of. So with phytonutraceuticals, also patients can get good erections and have. So what's new in the medical lineup? We have avanafil, which has got a very short action, 15 minutes it starts acting, and the half life is 5 hours only. It gets washed away from our body within 5 hours. And so this can be given to patients who are on nitrates. If he's taking nitrates, stop the nitrates on that day, give him this medicine in the morning, and see within 5 hours this also will get washed away from the body, and he can again take nitrates on the next day. So this is very fantastic, very good drug, and it has got less side effects compared to sildenafil and tadalafil. My last part of my talk: why we need sexual health today, why it is the need of the hour today. Let us think far, think wide, and think high. PD5 inhibitors definitely are improving. They also improve the mitochondrial functions and improve the contractility and the blood flow. We don't deny that. PD5 inhibitors are nothing but the nitrates for the corpora cavernosa. Agreed, very good. They do improve, fine, but they do not cure about it. We know the favorable effect of SGLT2 inhibitors and metformin. Fantastic. They also can give patients good erections. And direct study which was seen that there was a remission of type 2 diabetes in men who just concentrated on a low calorie diet. So this has also been proven that reversal of diabetes is not a myth but a reality today. So in patients who are diabetics and having erectile dysfunction, giving them drugs or lifestyle mod or total low calorie diet, they can reverse the erectile dysfunction or there. My friend Dr. Paresh Dandona started giving testosterone to diabetic patients who have hypogonadism and sexual dysfunctions for about 2 years. And in less than 1 year, he found that there was improvement in hypogonadism, even improvement in insulin resistance and in obesity. So testosterone therapy can be given to patients who are hypogonad and diabetic and can reverse the endothelium work. Dean Ornish long time back proved that with intensive lifestyle he can reverse the cardiovascular disease or the coronary heart disease, and he put these patients on a vegetarian diet, aerobic stress exercise, stress management, and in 5 years he found that the coronaries were completely open in spite of they having 95 to 98% block, and this was studied beautifully published everywhere across in. And when we call certain diseases genetic, remember friends that 20% of how long a person lives depends upon the genes, and 80% is dictated by your lifestyle. So lifestyle is very very important in every patient who has got any disease particular. And most of the risk factors, if you look at it, are sedentary lifestyle, smoking, and
دقيقة
diet which is
نقرب
erratic.
سكت تاني الصوت بيتكلم عن الريكتايل ديسفانكشن.
اسمعي هذا كويس.
طب عايزة أصلا حاطة في الشاحن،
عايزة ايه؟
تحط لي المشترك ده هنا.
فين المشترك؟
حطه في الفيشة، حطه على الترابيزة جنبي. بيقول لك زيرو فات. هنظر من وشك اهو.
لا لا
حطه في الفيشة وهاتولي هنا. طيب.
Can you see me now? Hello? Hello? The host has stopped my video. The host has stopped the video. Can you start the video, please? Hello, can you hear me? Hello.
Hello, Doctor Uheri.
Yeah, but he has stopped the video. The internet guy has stopped the video. Can you start the video?
Okay. You can start now, Doctor.
Yeah, now it's okay. So even the Cleveland Clinic clearly mentions that it is the nutritional intervention which will not only halt but even reverse the coronary artery disease. Look at this perfusion scan. Such a huge block was clearly opened up just by nutrition. This huge plaque, there is no stent put inside, but just with nutritional intervention. So even if you get a patient whose angioplasty is done or bypass surgery done, we find these patients have to undergo redo surgeries or replasty done after some years. But if you advise your patient nutritional intervention, this will not only halt the progression of the disease, but also reverse the disease. So here is what is important, is to understand that how nutrition plays in reversing the cardiovascular disease and also the sexual dysfunctions which are there. And today we see a lot of patients going in for. So the doctor of the future will no longer treat human frame with drugs, but rather will cure and prevent disease with nutrition. Now, the point here is, should we consider endothelial dysfunction, and can we reverse it or can we restore it? Yes, you can restore it by statins, ACE inhibitors, antioxidants, L-arginine and estrogen therapy. My friend, my teacher, Dr. R.D. Lele, published so many strategies to reverse endothelial dysfunctions, which are available. So this mechanism is in place to reverse the endothelial dysfunction and make the endothelium normal. So if the endothelium is normal, the blood flow in the penile vasculature can be normal. So the future direction will be, it is the arterial wall damage which occurs can be easily reversible if you detect it as early as possible. So this mechanism is there in place today. So we need to take advantage of this and try to cure our patients completely, not to just give them PDE5 inhibitors and give them symptomatic relief. So the secret of sexual fitness or health is you must love your body. Everybody's body is unique and nice. And you should avoid salt, oil, and sugars in excess. Give a U-turn to your metabolic imbalance. Have a regular rhythm of sex life. There is hardly any romance after a certain time, and couples hardly touch each other, which is the main cause of incompatibility or inhibitions or avoiding each other. Hugging is very important. Romance, there is no tax on romance. It is a shame for a man to grow old without seeing the beauty and strength of which his body is capable of. So when it comes to women consider to talk about sex is sin. They are all tight-lipped. But yes, we can manage female sexual dysfunctions by CBT, sex therapy, mindfulness, controlling hyperglycemia, hypertension, and also treat. We need to identify these problems. We need to give them counseling, lifestyle changes, pharmacotherapy, mindfulness, etc. And we have a lot of medications to give to our patients with female sexual dysfunctions. And amongst them, flibanserin, Botox is given for vaginismus, flibanserin for low desire, PDE5 inhibitors, even testosterone, tibolone, bupropion has been very good for patients with women having diabetes and depression. So my take-home message is that the onus of sexual health of our patient lies with the physicians. We need to be proactive. We need to cross the barriers, the clinical inertia which we have, and ask our patients one simple question, that do you have problems in making love? If you ask this question, friends, please trust me, your patients will be so happy and you will feel that they were waiting for you to start a dialogue on this aspect. Teach them what is reality. Give them realistic expectations. Sex at 60, 70 will not be as good as it was in 20 and 30. So explain to them all these things and tell them what is going to happen. Take a detailed history of your patients. Advise them on lifestyle, because lifestyle changes will improve the pro-inflammatory milieu, improve the insulin resistance, ultimately lead to improved well-being and reduce burden of sexual dysfunction. So, and 2 times Nobel Prize winner Linus Pauling said that nearly all diseases can be traced to nutritional deficiency. When such a big scientist who received 2 Nobel Prizes is telling you that your nutrition is responsible for everything which you have. So that is within our reach, it is very easy for us to counsel our patient and explain to our patients scientifically that nutrition is very important for you. Lifestyle should be your religion. You may be Muslim, you may be Hindu, you may be Sikh, you may be Christian, but make lifestyle as your first religion. And all the ingredients of lifestyle modifications we know. We have 4 inhibitors. None of them increase your desire. We have 40 to 50% non-responders. And then we have testosterone. But we need caution. Younger patients will get azoospermia. Older patients will get heart failure or prostatic issues. We need to give it with caution. We need to monitor with PSA. So the Raja of all today is L-arginine, which produces nitric oxide, fenugreek, which produces free testosterone, and lifestyle modification and regenerative medicine are the key things. So if you have all these things, most of the male sexual response can be managed easily. So today, for erectile dysfunction, whatever may be the cause, everything can be managed. Hypogonadism can be managed. Ejaculatory disorders can be managed. In female sexual dysfunction, psychotherapy, pharmacotherapy, dilators, Botox, and DHE and flibancin for low desire. But what we need to understand, there has to be love between to each other, irrespective of whatever the situations are, because you all are partners for life. Unless we love and are loved, each of us are alone. Each of us are deeply lonely. Those who love deeply never grow old. They may die of old age, but they die young. So this is what we need to understand. Men who have sexual issues, they ignore, they avoid having sex. They start giving excuses to their partner. I am tired. I will do this tomorrow. I've got a lot of work to do. I've got headache. I've got this, that. They avoiding, they don't take treatment. This should not happen. Feminism, they must respect, they have problems. Their partners do not have problems. So they do not have any problems. So they should try to understand, admire, trust, and respect their partners and take treatment. Go to the physician and ask their patients. And you need to be passionate even in the bedroom. So my last slide is, it does affect individual. It does affect your partner, and there is definitely a dent in the relationship. So this is what is seeing in day-to-day life in every couple today. In every family, I find 1 or 2 couple not satisfied with their relationship. So this all can be avoided by asking questions, by examining them, and all these things. So this is what is the need. We need to ask our patients, do you have problems in making love? Patients are embarrassed. They feel you'll be judging them. So they will not talk about it. So this is what. And in America, it was clearly said that sexual health is an important aspect of quality of life for men and women. So we need, today we got everything to treat sexual dysfunctions in our armamentarium. So this should not be a problem. What we don't have, we can counsel them on nutrition. We can counsel them on exercise. We can counsel them on smoking. We can counsel them on reduction of metabolic syndrome. What not we can do. So it is a blessing that if you get a patient of erectile dysfunction, you can counsel him and reverse. So today I call erectile dysfunction is a correctile dysfunction with whatever we have in our armamentarium. If you have patients of erectile dysfunction, you will find they're going to quacks, but send them to good clinicians like you or like me and see that they will get good sexual functions back. This is my book, Sexual Health, a manual. Sex has no expiry date, available on Amazon. My last slide. So by addressing physical, psychological, physicians can play a major role in helping their patients enjoy improved sexual functions and increase self-esteem. Sensitivity of the physician in approaching the problem is important. Lifestyle modification, counseling are the key. Sympathetic approach along with relevant treatment to these men and women will go a long way in improving their sex-starved lives. Regenerative therapies are definitely a promise. And if so, sex really has no expiry date. Thank you all for your love. I'll be happy to answer any questions you all have. I'm sorry for the technical hitch. Are there any questions? Hello? Am I audible?
Hi, Doctor. Fruitful meeting the subject. And I want to ask something. Can the approach be psychological first, or it
Yeah,
needs to be
actually,
discussed
every
chemically and medically
patient of
at
erectile
first?
dysfunction will have both. Every patient who comes to you with erectile dysfunction can have organic cause. He may be diabetic, but because of diabetes long standing, he may develop little depression. So there is a psychological component also in every patient who comes to you with organic erectile dysfunction. So please understand that there could be both together. Any more questions? Should we leave?
Any other
It's
question?
half past midnight. It
Good
is half
night.
past midnight. Can we take leave?
Good night, doctor. Any other question for Dr. Debak?
Yes, yes. What is the question, sir?
I asked the doctor that they have a question, doctor. Thanks Dr. Debak for your lecture and see you soon inshallah.
Welcome, my pleasure. And congratulations to everybody, and thank you very much. It was pleasure talking to you all.
Bye bye.
Should we take leave?
If you want, sure.